I'm Justin Voris, family medicine physician at Fort Smith. I was born and raised in El Dorado, Arkansas, and from there I went to Ouachita Baptist University in Arkadelphia. After that, I had a career as a medical technologist for a few years before going to medical school, and residency took me here to Fort Smith, where I was able to get a quality education in the broad scope of family medicine. I didn't know that I really wanted to be a doctor early on. I was a kid. I wanted to be a fighter pilot or a baseball player. And I was walking into the hospital, I was probably 9 or 10, and I was going to visit my grandmother who worked there. And as a kid, a hospital is a pretty daunting place. And so as much as I didn't want to be there, as soon as I walked through those doors, I had this overwhelming feeling of, you're going to be a doctor. And I can't explain it other than that was just God talking to me as a kid saying, this is what you're going to do. I'm a busy dad with 3 children and a wife and a dog, and we do a lot of sports locally, and we're able to go up and see the Razorbacks play from time to time, and we really love Razorback baseball. So that's a lot of fun. We love being outside and going on hikes and using the trails around our area. In my clinic, I have a pretty broad scope of practice. I see from birth all the way down to the end of life. And so I take care of babies, newborns, up until the end of life. I see a lot of diabetes and high blood pressure and obesity and metabolic disorders and cancers, and we really kind of cover a lot of ground in family medicine, so I see quite a bit. So whenever you come to the Mazard Clinic, we essentially know you by name. We know most all of our patients quite well and have that established relationship with them. Really, the broad scope of family medicine is really interesting to me, because it kind of sets me apart to be able to do a little bit of everything. And so I don't have to do a lot of referrals to people. I can take care of a lot of things in the office. I still do come to the hospital to help deliver babies and take care of infants in the NICU or nursery. I share a call with the UAMS West faculty to help teach a residency program. And then with the new DO school out there, I do supervise medical students as they come through and on their learning process. It's important for people to see a family medicine physician because of our extent of training. We've seen quite a bit, and of the years of experience that we have, we're able to treat simple things as well as very complex things. And so kind of the neat thing that I'm able to do is be able to see again, kids all the way to grandparents, and you start seeing generational things that happen among families. And so establishing that relationship is really helpful to get going with your health.